So thank you very much, Jennifer and Laura. We're going to keep moving on. Recently, I had a conversation with a former resident where we were discussing her job choices for after her fellowship. We were deciding between an established, highly academic program and a less established and seemingly less academically rigorous program. She stated that she was leaning towards the less academically rigorous program because she didn't think she could do that much scholarship because she didn't like research. She saw the requirement for scholarship with the same narrow view that many of us have, where research is equated with scholarly activity or in scholarship, and all else is seen as less than. This is something that's been going on for the last 150 years or so since the word research was introduced in the lexicon of higher education. I argue that there's a wider view of scholarship, a newer view reborn, that many of us in this room have used to build our careers. Understanding that view serves as the foundation for us to discuss how to do scholarship and do it well. I'm Christine Stehman from the University of Illinois College of Medicine, Peoria, OSF Healthcare, and I have nothing to disclose. So to really understand how to do scholarship well, first we have to understand what scholarship is and what scholarship is not. During the 20th century, medical schools in particular started focusing on research and equating productivity with research papers published and grants received. The productivity resulted in academic rank that many desired and was seen as the ultimate symbol of scholarship. These researchers were asked to teach and occasionally to actually apply the results of the research, but these things were considered from scholarship and not actually being part of scholarship. In their article, Putting Teaching Back at the Center, Hansen and Roberts reminded us that the initial and ultimate purpose of medical schools is to teach, not to get research done, not to get grants. And they went on to argue that a person demonstrates scholarship when they advance or transform knowledge in an informed, disciplined, and creative manner, leading to products that might be made public and be peer-reviewed to assess for quality. This was hearkening back to the original definition of scholarship, a variety of creative work carried on in a variety of places, and with its integrity measured by the ability to think, communicate, and learn. All of this came, for medical education, out of Ernest Boyer's Scholarship Reconsidered, based on research on faculty values in the late 1980s. He flat out stated that equating only research to scholarship was not inclusive of all that scholarship is. He reminded us that there is a great diversity and a huge breadth of scholarship taking place at our institutions of higher learning. Because of that, we needed a definition of scholarship that reflected that diversity, leading to better ways to evaluate scholarly performance. To do this, he revolutionized the academic community by expanding scholarship to include 4 separate but overlapping types. The scholarship of discovery is what has recently and traditionally been considered scholarship, research. Disciplined investigative efforts that both advance knowledge and figure out new ways of advancing knowledge. So they look at both the outcomes and the process of achieving those outcomes. And here we ask the questions, what is there to know and how do we figure it out? The scholarship of integration builds upon the scholarship of discovery in a lot of ways. During integration, we take the facts and connect them to the world around us. Through discipline, those who focus on the scholarship of integration find relevance, context, and connections, while focusing on the question of what do the findings mean and how do they fit in. The scholarship of application, or the scholarship of service, instead of just connecting everything to the surrounding world, actually makes sure that we apply research to consequential problems, and even says maybe we should consider the actual problems first and then use that to define our research agenda. So looking at how can we serve the community around us and then use that to bring up new areas of investigation and integration. The 4th area that Boyer mentioned is the scholarship of teaching. He says that teachers gain knowledge, they transmit the knowledge to learners, they create new ways to do both, and then they transform and extend the knowledge, but he didn't really flesh it out as much as he did the other 3. He suggested that we focus on the questions of how does knowledge get to others and what is the best method of transmission. But Boyer's work was just the beginning. It got the discussion started, but there was a piece missing. And that piece was how to measure the quality of whatever scholarship was produced. Because if it's not measured, we have no results. 1997, Glassick et al. Built upon this by giving us six criteria to figure out how to assess the scholarship. They stated that for a work of scholarship to be praised, it must be characterized by 6 things. These are clear goals, where the person has clearly stated purpose, they have realistic and achievable objectives, and they've identified and asked the important questions. The scholar has done adequate preparation, where they've looked at existing scholarship to build upon it. They have the necessary skills to do the work they want to do, and they have used the necessary resources out there. They've chosen appropriate methods that are connected to the goals. They've applied them effectively, and they're willing to change their methods slightly as change occurs in the circumstances. They get outstanding results. We answer the questions. Were the goals achieved? Does the research add consequently to the field? And are there additional areas of exploration identified? Now, I have a star up here because a lot of people think outstanding means positive, but there is nothing in here that says that negative results can't be outstanding results. That does often add consequentially to the field. Once a scholar obtains results, they must effectively communicate those results with a suitable style and organization, identify and use the appropriate forum for the attended audience, and they need to present them with clarity and integrity. And finally, as part of it, they need to do a reflective critique. They need to make sure they critically evaluate their work, placing it within the field, using appropriate breadth of evidence, and use that evaluation to improve the quality of their future work. So we've defined scholarship and how it should be assessed, but while I mentioned the scholarship of teaching, I didn't mention the education scholarship, but we're here at the Education Summit, and many people refer to education scholarship, so you might be wondering if that's just a made-up term. As I mentioned, Boyer didn't really flesh out his scholarship of teaching, as well as he fleshed out the other 3 categories. People first talked about studying various teaching models and practices to optimize learning, but then they realized that the scholarship of teaching was just one category in what should be called, to follow the tradition of Boyer, the scholarship of education. Schulman gave us our first piece towards the scholarship of education when he stated that for there to be scholarship of teaching and not just scholarly teaching, you had to have work that was publicly available, peer-reviewed and critiqued, and reproducible and able to be built upon. On a side note, Schulman helped us realize that there are actually 3 parts of scholarship. First, you have something new view, new knowledge, new application, that gets disseminated and assessed, and then gets fully critiqued and built upon. So that's what you have to do to generally do scholarship. But when it comes to the scholarship of education, the AAMC fleshed out what they called the scholarship of education in 2007. They gave us 5 categories of common formats of presenting educational contributions when we talk about promotions, and these categories are teaching, no surprise, but also curriculum development, advising and mentoring, educational leadership and administration, and learner assessment. And they said along with these categories, each of the categories has 2 core elements which are common documentation standards: educational excellence and engagement. The educational excellence, no surprising, quantity, the types and frequency of what you contribute, and then the quality, the evidence of the effectiveness and excellence. Because if you do a ton of things and you're a crappy lecturer or a crappy teacher and nobody learns anything, it doesn't really matter how much you do. But then there's also the engagement. And the engagement part has 2 parts to it. The first is that the work is informed by what is known in the field, and then that the educator contributes to the knowledge in the field. This last piece, this engagement, this is what differentiates between scholarly activity and scholarship, and shows that not every clinician who works in an academic department actually and contributes to their department's list of scholarly activity is actually doing scholarship. So scholarly activity, you take what's there and you build onto it. While in scholarship, you actually take what's there and build something new from it that other people can also build upon. Okay, you're saying, I've looked at this. I've got my education scholarship down, I'm rocking it. but I'm here because I want to get promoted and I want to do something more. I want to level up. So how do I do that? Well, I got some tips for you. There are 4 ways to think about it that you can do something different. So the first is, education scholarship as a noun refers to any material, product, or research originally developed to fulfill a specific educational purpose that has been successfully peer-reviewed and is subsequently made public through appropriate dissemination for use by others. But does it really have to always come from the scholarship of education? Well, not really. First, much of what we do related to scholarship of education is still somewhat related to the formal classroom. However, in emergency medicine, the heart of what we do is clinical work. Since the clinical work informs everything we do, and the scholarship of application involves service and the use of knowledge to solve problems for individuals or society, linking these two together can come in many different forms that might include curriculum development. People are developing a social determinants of health curriculum or new well-being curriculums. Restructuring your clerkships so your medical students get a better idea of what it's like to really work in the job of emergency medicine. Or maybe even implementing evaluation tools or new programs, maybe involving community outreach or having the patients help evaluate your residents or your students as doctors. All of those are more of that application into scholarship of application. But you can also do scholarship of discovery or scholarship of integration related to clinical education. What is being done somewhere else, like maybe in a different residency in your same institution, the peds or the surgeons, and how can it help me do things better in my world? There's actually an AME guide that walks readers through how to produce education scholarship products in any category, specifically differentiating between the scholarship of discovery related to education and the scholarship of education. In it, the authors mention how the scholarship of discovery is more scientific and offers more distance than the scholarship of education, because in the scholarship of education, often it's our product and we have much more ownership of it, so we're actually involved in the research process. So maybe when you try and reproduce somebody else's results for a curriculum or a program evaluation, you're actually more likely to do discovery than the scholarship of education, because you have that distance. It's not yours. Okay, so I don't really want to do that. I don't want to do discovery. I like my scholarship of education. Well, maybe try a different category. Remember, I mentioned there's 5 different categories within the scholarship of education. Maybe you're a phenomenal teacher and you've actually developed some great curriculum and you do an awesome job advising and mentoring, but you've never had an educational leadership or administrative role, or you've never done any learner assessment within it. Or maybe you've done scholarly activity in those 2 areas, but you've never actually pushed it over to scholarship. So think about another category that you can do. Then there's something called the Clinician Educator. In 2014, Sherbino, Frank, and Snell published the results of a mixed methods study that sought to define the desired scope of a clinician educator, where they said that these people hold advanced expertise in education and could serve as both consultants and leaders in medical education. And they gave us a little bit of a guide of how you could become a clinician educator. The first is you need to hold 4 roles. They need to participate in clinical practice, so that person who never holds an actual, never takes an actual shift, it's really hard for you to understand what's going on in emergency medicine if you're not actually practicing emergency medicine. You need to use theory to inform your education practice, which Dr. Krasaniak will talk about a little bit later. You need to engage in actual education scholarship, and then you should be the person who helps with education issues and be the consultant. Within that, you have 7 domains that you should be competent. You should be able to assess people, to communicate well, develop curriculum, use education theory, be a leader, produce scholarship, and be able to teach. And there's a paper I can send to anybody who's interested that you can take a look at this. But like I said, Sherbino, Frank, and Snell are really good at this. But the ACGME actually took this and defined clinician educators as faculty members who have formally incorporated educational principles and scholarship into their role for more effective teaching and learning. Then they created milestones for us. These include, it is still in the developmental testing phase, like they literally just sent out a survey in the last 2 months, so it's at the start of everything. They have 3 foundational subcompetencies, then 9 subcompetencies within education, theory, and practice that focus on optimal development of learners, a well-being competency, a diversity, equity, and inclusion competency, and 4 subcompetencies within administration, reminding us that just because you don't hold a leadership role does not mean that you're not doing some form of administration or leadership. So if you're looking to become a clinician educator, these milestones could serve as your roadmap. They're not going to be, from what I understand, they're not going to be required, but they're there to help you self-assess and decide what you need to work on and where you could be better, or even use as a peer review process. And the last option for leveling up is to think differently, okay? So we often look at Kirkpatrick's model, the Miller's pyramid or prism, or Bloom's cognitive taxonomy as ways to see how we're doing with our teaching and how our learners are learning. Is there a level that you stick to? Do you tend to go to knows and knows how on the prism and never really go to show how or does? Or do you stick with knowledge and comprehensive but never get to the synthesis on Bloom's? Maybe you can go up that ladder, up that pyramid a little further with the next time you do a course or a session. Then maybe you think the opposite direction. In Understanding by Design, Wiggins and McTeague argue that most of the time educators use what they call forward design in their course content development. In this method, they look at how to teach the content, their learning activities, then they design the assessments based on those learning activities, and then finally draw connections to the learning goals of the course. This focuses on teaching. But as a way to level up, for your next presentation or course, consider trying the author's backwards design instead. In this plan, you identify desired results, i.e. the goals, then determine acceptable evidence of achieving those goals, and finally plan the learning experience around that. How do you decide how they're going to learn best? This, instead, is a focus on learning. Another way to level up would be to think sideways. D. Frank asks us to go beyond cognitive learning, i.e. Bloom in particular, and define learning in terms of change. For learning to occur, there must be a change in the learner. So to consider this, we need to ask the questions, in what ways can learning be significant? And which of these ways do you want to support in your teaching? So, since you need lasting change that's important to have in the learner's life, D. Frank actually created a framework taxonomy of 6 relational and interactive areas of significant learning that are up here on this picture. The thought is that any of these goals or assessments, or any goals or assessments based on these areas, will offer a more significant change in the learner, and they're all interrelational, so if you do a really nice job creating change in one area, you're going to encourage change in other areas. And lastly, based on these last 2, the backwards design and the significant learning, they combine into something called integrated course design. In this, the significant learning taxonomy is the basis for learning goals, and the backwards design concept is the order in which the areas are considered. But the method of course design emphasizes the interrelatedness of all the factors involved. So I just threw a ton of information at you at what scholarship is, how it expands upon scholarly activity, how it's done well, and where you can level up. In the rest of today's Education Summit, we're going to build upon this to give you a toolbox for how to do and disseminate your scholarship and how to get credit for what you're doing in terms of promotion. So if anybody has any questions while we get set up, this is the summary of what I've talked about, and then we'll move on to Dr. Gisandi if nobody has any questions.
Hi.
Yes, sir.
Tom Yang, Lincoln College, Wisconsin. Thanks for a great presentation. I just want to hear what, we have some vice chairs and, higher ups here about how do you, now the fact that we're in an era of e-publications, or the fact that we have podcasts and blog posts.
So Dr. Yang, I'm going to stop you because we actually have a whole portion of our session on that in a little bit. So I'm going to have you save that question for after Dr. Gutman's done, because he's actually going to talk about it in a little bit. Okay?
Sure, no problem.
Does anybody have any other questions for me?